Welcome to Club Nurse. I'm Colton Lord, your host. By you being here today, it shows me that you are someone who wants to learn, grow, laugh, connect, and just let your emotions flow. We are here to share real stories and hear real life experiences from real people. You are not alone in this, and Club Nurse is here to show you that. Don't forget to follow the show and share today's episode with someone you love. Now, let's dive into today's conversation. Welcome back to the Club Nurse podcast. This week we are covering some more nurse news for you. If you are interested in any of these stories and you want to look into them further, you can always go to Nurse.org/news to find all of the written articles and more in detail information about these stories that we talk about on the Nurse News segment. But there are a few stories that I want to highlight, and that's kind of how these news episodes work. Really, I just kind of sort through these stories that I'm seeing on social media or on Nurse.org and just kind of looking through these news articles and seeing what I think is the most important to highlight for several different reasons. Sometimes it's just for more entertainment. Sometimes I think it's just really educational and information that needs to be spread around, which is why I choose to put them into this segment of the Club Nurse podcast. So let's talk about this week's nurse news. This first story that I'm going to talk about is really, these videos were really difficult to watch. A lot of social media creators covered this story and talked about it in their content, and for good reason, to really just spread awareness and to make this story known. I don't know if any of you had the chance to see this. Like I said, it was really difficult to see, but basically there was a patient who, and importantly, a Black mother who was in the triage booth in the emergency room, is what appeared, who was really being ignored, and her symptoms were being completely just pushed aside. She was obviously in active labor. And I can tell you from experience as an ER nurse who has done, has triaged several patients, this is not something that you just sit there and ask questions to the patient. If somebody comes in who's pregnant and is in that much agony and who's obviously uncomfortable, you don't waste time. You get them back. You don't even sit there and try to get their vitals. You get them back to where you can put monitors on them, get a monitor on the baby, and with really the goal to get them the heck out of the ER into labor and delivery. No ER nurse that I know, or an ER doctor, ER provider that I know, want to see a baby delivered in the emergency department. So like I said, this video was really difficult to watch, and the patient was obviously being ignored by the triage nurse. And I don't know if this is true. I did see I'm not sure if any of you saw the post going around that had the triage nurse with the red terminated word over the picture. I don't know how accurate that is. I don't know if she was actually terminated, but it does say that this nurse at Dallas Regional Medical Center was fired. And I just want to say, I don't like to highlight a lot of these stories that talk poorly on nurses. I think it's really important to try to actually really avoid that. But this one really needed to be brought to the light because this is important. And I think that, medical racism and these things are real. And I think people need to understand that. And this is not to highlight, obviously nursing in a bad way. But when these things happen, it needs to be brought to the attention of everybody because this is not okay. And I don't know all the details, all the statistics, but I do know that, when things like this happen, obviously when there's any kind of racism or prejudice involved in care, obviously the outcome's not going to be great. And the video was being recorded allegedly by the mother of the patient who was just being straight up with the nurse and, was asking her, and I quote, "Y'all treat all your patients like this or just the Black ones?" And it's, again, this is a real issue. And if you want to see the video, just go on TikTok, search for it. It's everywhere, really. Okay, moving on to the next story of this week. The headline is Patient Rips Out Nurse's Hair and Now Faces Felony Charges. Well, that's great. I'm glad that something is happening. As nurses, we all know we've all been in the position to be assaulted or whatever it may be, verbally or physically. And you know what? This one was actually terrible. Sounds like this 18-year-old is facing Class D felony charges after allegedly yanking hair from a nurse's scalp during a confrontation. Yeah, that was hair. She ripped out her hair. So she is being charged, and that's great. I don't know. I think I've told the story. I've been in the position before in the hospital setting of being assaulted by a patient and having, the question of if I wanted to press charges. And honestly, my answer was no. I just felt like it was more work than anything. I think that if it was there, I've always said there's a threshold that if it was crossed, I think I would press charges. If I was physically harmed, i.e., if somebody ripped out my physical hair, or if I had to seek medical care, or if just anything came from it, I would probably press charges just to have it on record. But, I've been spit on and had asked, if I wanted to press charges for things like that. And again, I just feel like that's more paperwork and more things for us to do as nurses that's not really going to have anything come of it. So I think that's really to the discretion of the nurse. If you feel unsafe or if you feel like that you need to press charges and get it on record, then by all means, I think you have that right to do that. So if convicted, this person could face up to 6 years in prison and fines reaching up to $10,000. As the legal case against Fox proceeds through the Arkansas court system, it serves as a reminder that stronger legal protections are just one component of a comprehensive approach to addressing violence against healthcare workers. That is true. Okay, let's talk about the what nurses should know about the flu season this year, 2025 to 2026. I think it's always one of those controversial things. I feel like in healthcare and nursing of mandated vaccines and people not wanting to get them. And I think this was even more prevalent during the COVID pandemic because people were really not wanting to get. There was it was just like two sides. Like people either really wanted the vaccine or people really didn't. I think there were a lot of people that were really hesitant. But the flu vaccine, it's been here forever. It's proven to help to lower the severity of the infections or to help reduce the spread of the flu, which in the way I look at it is, if I did not necessarily work in healthcare and wasn't exposed all the time, would I get the flu shot? I don't know. It's hard for me to answer that. Do I think it harms us in any way? No, I really don't. I think that by getting it, you're at the very least, helping the elderly populations or the immunocompromised people who just need you to have that little extra layer of protection to also protect them. There are some differences in the flu vaccine this year, so let's talk about it. And I don't know if this is really that interesting to nurses, but they did switch from the quadrivalent to the trivalent, which is a major difference. This change occurred actually last flu season due to historical research of the flu infections that projects the data for the upcoming season. And so to kind of give a little bit of context on this, the US transitioned to the quadrivalent flu vaccine during the 2013-2014 flu season to incorporate a second flu B virus because at the time, both flu B viruses were seen, and the research showed that there was little cross protection between the two lineages. So, the World Health Organization and the FDA's Vaccine and Related Biological Products Advisory Committee, wow, that's a mouthful, found that influenza B and another lineage had not been seen in patients after March 2020, and that's where the recommendation came to remove the lineage from all future flu vaccines. So again, it's trivalent now, not quadrivalent. And also, I don't know what this is. This is the first time I had heard about this, but flu mist self-administration. So it's another change this year is that there's at-home administration of flu mist nasal spray. The flu mist home program allows all eligible individuals to self-administer or administer to another individual the vaccine. The plan was proposed last flu season, but did not take effect until this year. That's interesting. I've never heard of this before. So I'm interested to kind of hear more about this flu mist program. But yeah, get your flu shot. I'm sure if most of you who are working bedside have already gotten it because it's a requirement unless you're able to get a health or religious exemption. Oh, this next story. This one's kind of crazy. This school nurse was forced by a superintendent to compile a list of students with hand, foot, and mouth disease. So really, kudos to this nurse, Amber Wood, who was a school nurse in Illinois, because she really, was advocating for these kiddos, and she really was following her her knowledge as far as like HIPAA and what the laws were in her state, because the superintendent Timothy Farquhar was charged with official misconduct for accessing and sharing information. If you go to Nurse.org/news and find this article, you'll see the email chain that was sent out. They share this record of the email between the staff and this nurse and the superintendent, and yeah, he basically forced her to compile a list of the students who were infected, and they were sharing this information, who was vaccinated, and really without like parental consent. And so basically, I don't know again all the details into this, but they were violating several laws. And the nurse Amber Wood was not having it. She initially protested creating the spreadsheet and sharing the information because, again, HIPAA laws. And then she also worried about breaking the Illinois School Student Records Act. That act allows schools to share the student healthcare records with staff who have legitimate educational interests without parental consent. So she was worried about breaking both of those for good reason. And basically, what ended up happening is Farquhar was arrested, the superintendent. The Mercer County School District Board of Education released the following statement. Under the Illinois School Student Records Act, student health records are explicitly defined as part of the student's school record. Their use by teachers, school nurses, and support staff is not only common but necessary to meet the educational and developmental needs of our students. Moreover, the management of these records, including secure digital access, is administered by the district's IT department, consistent with best practice and statutory obligations. So there was 2 IT workers plus the superintendent who were charged with Class A misdemeanor of unauthorized access to medical records, Class A misdemeanor of computer tampering, and a Class 3 felony of official misconduct. All have pleaded not guilty and are facing up to 5 years in prison if convicted. So, wow, again, be careful out there. And this is just another example of abuse of power and really bullying this nurse. And she was not having it. She stood her ground, and good for her. Oh my God. Can we talk about this? Why are there so many people who are falsifying their nursing credentials? This is crazy. Another fake nurse was sentenced, and why credential fraud is rising in healthcare. So, Thomasina Ampanash posed as a nurse at more than 40 Maryland facilities using stolen identities and falsified credentials. She received a 38-month federal prison sentence and must repay over $145,000 that she earned through this fraud. Her case joins a growing list of high-profile nurse impersonation incidents, underscoring the need for stronger credential verification. So Thomasina Ampanash is a Baltimore County woman with a background as a certified medical assistant, but she never had a valid licensed nurse credential, no LPN, no RN license. So how she did this, how she impersonated a nurse, was from September 2019 through August 2023. Ampanash fraudulently posed as a nurse at no less than 40 healthcare and skilled nursing facilities throughout Maryland, as well as a public school. She used stolen identities, faked her experience, and at one point citing a previous LPN supervisor role, as well as a degree from Florida State University. No surprise, using more Florida fake degrees, and even incorporated a victim's name into her falsified documents. She allegedly forged a physician's signature on a controlled substance prescription for tramadol, faxed the fraudulent order to the pharmacy, and that was how she was discovered and terminated after this deception. Her actions included failing to administer prescribed medication to patients and falsifying supporting documentation, which put patient safety and trust at significant risk. So she was ordered to pay $145,000 in restitution, the amount she fraudulently earned while impersonating a nurse, which that's all she earned in 4 years as a nurse. I don't know what she was doing. Wow, it's a lot. So yeah, she joins the list of a lot of other people who are impersonating nurses. And the big question is to why is credentialed fraud on the rise? Recent data shows that healthcare fraud prosecutions and schemes are increasing in both scale and sophistication. For example, a federal report found that healthcare fraud offenses rose nearly 20% between 2020 and 2024. And the several factors that are contributing to this are the increase in complexity of healthcare delivery, more providers, more facilities, and more moving parts, which creates more opportunity for false credentials and falsified identities to slip through. And also just the greater use of staffing agencies, travel nurses, short-term hires just means quicker like turnover and credentialing cycles, which is sometimes leads to just a weaker verification process. Yeah, wow, that's crazy. Another person impersonating nurses using fake credentials. And really, it's just dangerous. I don't know why people do this. I understand, I guess, maybe the why behind it because they want a job and money. But I just feel like there's so many other ways to do that versus impersonating a nurse, and how dangerous it is to put yourself in the shoes of a nurse when you're not properly trained. But all right, those are the stories I wanted to cover this week on the Nurse News segment of the Club Nurse podcast. So thank you so much for being here. Thank you for listening. Again, if you want to learn more about these stories, be sure to go to Nurse.org/news, and you will find all of the up-to-date nursing stories, breaking news, and all the things. And be sure to follow the Club Nurse podcast on Instagram at club_nurse. All right, we will catch you guys next time. Thank you so much for listening. Bye. From the bottom of my heart, I wanted to thank you for being here at Club Nurse. I hope you gained something valuable from today's episode. And if you did, remember to share this episode with someone that you love. Follow me on socials at Nurse Daddies or Colton Lord 17, and be sure to follow Nurse.org to stay informed with all of the hottest healthcare topics. Until next time, take care of yourself the way you take care of everyone else. Love ya. Bye.